My name is Rachel King, and I'm a nursing student at the University of South Alabama, and I'm going to be demonstrating how to insert an IV saline lock. So first I'm going to verify the order. Now I'm going to perform hand hygiene and check the patient's 2 identifiers on their wristband and make sure they're the same as the order form. So I'm looking at the name Jaguar Jones and the medical record number 4176352, and I'm also checking for allergies, so I see penicillin. Now I'm going to perform hand hygiene once more. Raise the bed to a comfortable working height and lower the side rail. Now I'm going to organize my equipment using aseptic technique, so I'm going to remove them away from me. And then this doesn't have the packaging on it anymore, so I would just not open it all the way and make sure it's not, like completely touching the table or anything. And then I already have my 3 pieces of tape. I had to stick them over here on my nightstand because there's really nowhere for me to stick them right here. So now I'm gonna I'm gonna clean the tip of the saline lock and prime the saline syringe. So I'm cleaning it with my alcohol wipe, just like that. Okay, and now I'm going to set this back in here so I can show how I would prime this. So I'm going to pick this up and show in the trash can. So just like that to get any air bubbles or anything like that out. Okay, so making sure I don't touch the top part that I just cleaned, I'm going to connect the 2. And then I have my little packaging that all of this came out of sitting right here. So I'm going to lay the parts that are clean on there. And now I'm going to list the 3 principles for selecting a vein and the 3 principles, or the 3 principles for fostering a venous, like a vein distension. So for selecting a vein, you're going to use the most distal site, the non-dominant arm if it's possible, and select large, soft, spongy veins. And then for venous distension, you would stroke the vein lightly, have the patient open and close their fists slowly, and then place the extremity in a dependent position. So like have them rest their arm on something so that they're not like physically holding their arm up. So now I'm going to apply my tourniquet, and it's going to be 4 to 6 inches above the site I choose. So I have it just like this so I can quickly release it. Okay. And now I'm going to put on my clean gloves. And I'm going to move my my little syringe and the lock over here closer to the bed. And now I'm going to clean the site with my chlorhexidine. So I've already got it opened, and you just squeeze it. I think this one's already, yeah, you just squeeze it to make it pop. So I'm going to clean all in here. I'm going back and forth, up and down, and in a circular motion. So side to side, up and down, in a circular motion. And I do that for 30 seconds. So, let's see, cleanse the site. Okay, so now I'm going to, I would have already found my vein at this point, obviously from me earlier stating how I would have found it, so I would know where I'm going. And I'm going to make sure that the little slant part of the needle is facing up. So let me see if I can get that on. It may not pick up. But the part of the needle that that's going in first is the part that's slanting down like this. So I'm gonna pull down away from the site, about 2 to 5 inches below the site. I'm gonna pull away from the direction that I'm gonna insert, like this. So I'm pulling the skin this way because I'm gonna be inserting this way. Let me make sure that, yeah. Okay, just like that. I don't know if we can, okay. So I'm going to advance about another 1/4 of an inch. And then I'm going to push, let's see, I'm going to bring it up here. So I've advanced it the rest of the 1/4 of the way in, and I'm going to, obviously it wouldn't be exactly like this. Oh, let's see. Okay, let me just do it without. Okay, so the catheter is in. I'm going to dispose of this in the sharps container. But I advanced this blue part of the catheter. Once I stuck the needle in, I grabbed the blue part of this catheter and pushed the rest of it in. So. So I would also, wait, let me see. Oh, before I did that, I would have instructed the patient to, like, get ready, like, tell them that they're going to have, like, a small stick. And I would have had this ready as well, but like I said, I was trying to hold it up there so that we could see. So this would have already been loosened, or it was loosened. And I would have attached it just like that, so it's tight in there. And so at this point, I would check for blood return, and I would what's it called? Aspirate, that's what it is. Aspirate. So I would pull back and push in. So there we go. And then pull it back in. Okay. So I'm gonna make make sure I'm not going to get this anywhere on my bed. I'm not going to, normally I wouldn't pull back like I just did. I just want to make sure that there's not going to be any on my bed, and I also wouldn't have pushed it back in like that with my finger, but okay. And so I'm going to temporarily secure this with my tape. I'm making sure I'm below that green part on there with my tape. Oh, man, this, okay. So, let me think. Okay, now I need to get my Tegaderm. And I'm going to place it. And so now I can remove my temporary tape. That was holding it in place. And permanently secure it just like that, making sure there's not any kinks or anything in that cord. So I'm going to show, so we have it just like that at this point, and I would remove my tourniquet. So I don't know if I verbalized this earlier, but after I stuck the catheter in, I would place pressure about 1.25 inches above the injection site until I was able to secure it with the tape. So I don't know if I verbalized that earlier, but anyways. Let me think. Okay, I think that's it. So I'm gonna dispose of all my equipment, but I'm really just gonna slide it over here because I don't want to throw it all away. And now I'm gonna make my label. So it's gonna have the time, the date, my initials, and I would apply it to the edge of the I guess, Tegaderm, yeah. So, did my label. So now to, wait, let me see. The time, the day. Oh, for the label, I also need to write, it says it on here, the size of the device, so the gauge of the needle. I forgot that part. Okay, so now obviously now I would reposition the patient raise the side rails, lower the bed. To take off the catheter, or to remove the catheter, so I'm going to remove the tape just like that, and I'm going to pull inwards towards the site. Just like that. And where did my gauze go? Oh, it's over here. Apply pressure to the site and gently remove the catheter like so. And apply the tape.